If you've noticed a constant feeling of mucus stuck in your throat, frequent coughing, or a heavy chest that just won't clear, especially after the age of 50, you are not alone. This is one of the most overlooked yet quietly dangerous issues affecting older adults today. Excess mucus is not just uncomfortable, it can interfere with breathing, reduce oxygen flow, increase the risk of infections, and slowly chip away at your energy, sleep quality, and even your independence. Many seniors assume it's just part of aging or a seasonal nuisance, but what if that assumption is costing you your health? The good news is that there are simple, medically supported ways to help your body clear mucus more effectively, starting with something as basic as a daily drink that supports your natural respiratory defenses. I am Dr. Walker Official, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and lung function to immune, resilience, and inflammation control. In this video, I'll show you what's really happening inside your body when mucus builds up, and the simple, practical steps that can truly make a difference. Here's what most people don't realize. Studies suggest that nearly 30 to 40% of adults over 60 experience chronic mucus-related symptoms, often linked to declining lung efficiency and increased inflammation. As we age, the tiny hair-like structures in our airways, called cilia, become less effective at clearing out mucus and trapped particles. This means that what your body once removed easily can now linger, thicken, and create a breeding ground for bacteria. Over time, this can lead to more frequent respiratory infections, reduced stamina, and a gradual loss of confidence in daily activities like walking, sobbing, or even sleeping comfortably at night. But here's where it gets even more concerning. Many seniors rely on quick fixes like cough, syrups, or decongestants that only mask the symptoms without addressing the root cause. Meanwhile, the underlying problem continues to build silently. In a moment, I'll walk you through a carefully ranked list of natural, science-backed solutions, from the least effective to the most powerful, including one simple drink inspired by longevity practices that many people completely overlook. And I'll also reveal a common mistake that may actually be making your mucus worse without you realizing it. As we move deeper into this issue, it's important to understand that excess mucus is not random. It is your body responding to specific biological changes that become more pronounced with age. Inside your respiratory system, mucus plays a protective role. It traps dust, bacteria, and harmful particles before they can reach your lungs. But for this system to work properly, it depends heavily on two key components: the consistency of the mucus and the efficiency of the cilia, those microscopic, hair-like structures lining your airways that continuously move mucus upward and out of the body. After the age of 50, and especially beyond 60, several changes begin to disrupt this balance. First, clinical studies have shown that ciliary function can decline by up to 40%, meaning mucus is no longer cleared as efficiently as it once was. At the same time, aging is associated with a natural increase in low-grade inflammation, often referred to by researchers as inflammaging. This chronic inflammation signals your body to produce thicker, stickier mucus as a defense mechanism. Unfortunately, this type of mucus is harder to move, leading to buildup in the throat, chest, and airways. In addition, hydration levels tend to decrease with age, even in individuals who believe they are drinking enough fluids. Researchers have found that older adults often experience a reduced sensation of thirst, which can lead to mild chronic dehydration. When the body lacks sufficient hydration, mucus becomes even more concentrated and difficult to expel. This creates a cycle. Thicker mucus slows clearance, and slower clearance allows more mucus to accumulate. Geriatric specialists also point out that the immune system becomes less responsive over time, a process known as immunosenescence. This means your body may not clear pathogens trapped in mucus as effectively, increasing the risk of infections such as bronchitis or pneumonia. In fact, respiratory infections remain one of the leading causes of hospitalization among adults over 65 globally. What makes this problem more concerning is that it often progresses silently. You may notice subtle signs, frequent throat clearing, a sensation of something stuck, or mild breathlessness, but these are easy to dismiss. Even individuals who follow general health advice, like staying active or eating balanced meals, can still experience mucus buildup because standard recommendations often don't directly target these underlying biological mechanisms. Understanding this root cause is critical because once you see how these systems are connected, cilia function, inflammation, hydration, and immune response, you begin to realize that managing mucus effectively is not about suppressing symptoms. It's about restoring balance inside the body. Now that you understand what's happening inside the body, it becomes clear why so many common approaches fail to solve the problem, and in some cases, quietly make it worse. One of the most frequent mistakes seniors make is relying heavily on over-the-counter cough syrups and decongestants. While these may provide temporary relief, many of them work by suppressing the body's natural urge to cough or by drying out mucus. Inside the airways, this can lead to thicker, more stagnant mucus that becomes harder for weakened cilia to move. Instead of clearing the system, it slows it down even further. Another common habit is increasing intake of dairy products under the assumption that they are harmless or beneficial for strength. While dairy is not inherently dangerous, clinical observations have shown that in some individuals, it can increase the sensation of mucus thickness and throat coating. This doesn't mean dairy directly creates more mucus, but it can make existing buildup feel heavier and more difficult to clear, especially in those already dealing with reduced airway efficiency. A third overlooked issue is shallow breathing and low physical activity. Many older adults gradually become less active due to joint discomfort or fatigue. However, reduced movement limits lung expansion, which is essential for natural mucus clearance. When the lungs are not fully engaged, mucus tends to settle in the lower airways, increasing the risk of congestion and infection over time. The deeper problem is this: most standard advice focuses on managing symptoms rather than correcting the biological environment that allows mucus to accumulate in the first place. Suppressing a cough, avoiding discomfort, or waiting for the problem to pass does not restore cilia function, reduce inflammation, or improve mucus consistency. But here's the encouraging part: this type of decline is not always permanent. When you begin targeting the root biological factors, the body often responds more quickly than expected. In the next section, I'll walk you through a ranked list of practical, science-backed solutions, from simple habits to more powerful natural approaches, so you can see exactly what works, what doesn't, and where to focus your effort for the best results. Let's break down the most commonly used foods, drinks, and habits that people turn to for mucus and respiratory support, and rank them from least effective to most effective based on how they actually influence mucus thickness, airway clearance, and inflammation in the body. Starting at number 10, warm water alone is often recommended. Hydration is essential for thinning mucus, and even mild dehydration can make secretions thicker and harder to clear. While warm water can provide short-term soothing relief and slightly improve mucus flow, its effect is limited because it does not directly address inflammation or cilia function. The improvement is usually modest, around 5 to 10% in symptom relief, and the benefit disappears quickly once hydration levels drop again. At number 9, menthol-based lozenges and steam inhalation are widely used. These can temporarily open airways and create a sensation of easier breathing. However, they do not reduce mucus production or improve clearance long-term. The effect is mostly sensory, giving about 10–15% temporary relief, but no real structural improvement in airway health. Number 8 is honey in warm water or tea. Honey has mild antimicrobial and soothing properties and may slightly reduce throat irritation. Some studies suggest small improvements in cough frequency, but it does not significantly impact deep lung mucus. Benefit range is around 10 to 20%, mostly comfort-based. At number 7, ginger tea enters the list. Ginger has natural anti-inflammatory compounds that may slightly reduce airway irritation and improve circulation. Some research suggests a mild reduction in respiratory inflammation markers, but its effect on thick mucus is still moderate at best, around 15 to 25%. Number 6 is turmeric with warm milk or water. Curcumin, the active compound, has stronger anti-inflammatory properties. However, absorption in the body is limited unless paired with fats or black pepper. It may contribute to a gradual reduction in inflammation over time, improving mucus consistency by roughly 20 to 30%, but results are slow and inconsistent. At number 5, breathing exercises and light walking become more important. Deep breathing improves lung expansion, which helps physically move mucus upward through airway motion. Regular practice can improve clearance efficiency by 25 to 35%, especially when combined with movement. However, it requires consistency and may be difficult for those with joint pain or fatigue. Number 4 is saline nasal rinses or saltwater gargles. These directly reduce upper airway mucus buildup and help flush irritants. They are more effective for sinus-related mucus and can improve comfort by 30–40%, but they do not reach deeper lung passages. At number 3, green tea stands out due to its antioxidant content, particularly catechins. These compounds may help reduce airway inflammation and support immune response. Studies show moderate improvements in respiratory comfort and mucus regulation, around 35 to 45%, especially with daily use. Number 2 is omega-3 rich foods like fatty fish or flax seeds. Omega-3 fatty acids help reduce systemic inflammation, which is a key driver of thick mucus production. Over time, they can improve respiratory fluid balance by 40 to 50%, but benefits develop gradually over weeks to months. Now, the number 1 most effective approach combines targeted hydration timing with natural airway supportive compounds that directly influence mucus viscosity and cilia efficiency. This is where a simple, strategic daily drink becomes powerful, not because it is magical, but because it supports multiple biological pathways at once: hydration, mild anti-inflammatory action, and improved mucus fluidity. When used consistently, this approach can significantly improve comfort, breathing ease, and mucus clearance efficiency compared to all other methods alone. Next, I'll break down the top 3 most powerful solutions in detail, including the exact prepare. Now let's focus on the most effective practical solutions that directly target the root causes of mucus buildup: hydration imbalance, airway inflammation, and reduced cilia activity. These are not quick sensory fixes. They are structured biological support methods that gradually help restore clearer breathing. The top 3 starts with number 3, consistent morning hydration with electrolytes. After sleep, the body is naturally slightly dehydrated, and mucus becomes thicker overnight. Drinking a glass of water with a small pinch of natural minerals or electrolyte balance first thing in the morning helps thin mucus and improve its movement through the airways. Clinical nutrition research shows that proper hydration timing alone can improve mucus clearance efficiency by up to 25% in older adults over time. However, the limitation is that hydration alone does not reduce underlying inflammation, so its effect is supportive but not complete. Number 2 is anti-inflammatory respiratory nutrition, especially foods rich in natural polyphenols, such as green tea, berries, and mild spices like ginger. These compounds help reduce the low-grade inflammation that thickens mucus in the first place. In geriatric, respiratory studies, consistent intake of polyphenol-rich foods has been associated with measurable improvements in airway comfort and reduced respiratory irritation, around 35–50% improvement in symptom frequency over several weeks. The downside is that these effects require consistency and are not immediate. Now, the number 1 most effective solution is a simple, structured, daily mucus-clearing drink strategy that combines warm hydration with airway-supportive natural compounds. The reason this works better than others is because it targets 3 mechanisms at once. It thins mucus physically, supports cilia movement through hydration balance, and gently reduces inflammation that causes mucus overproduction. A commonly used version involves warm water prepared in the morning, ideally on an empty stomach. It is often combined with ingredients such as ginger infusion or lemon-based warm water, which helps stimulate digestive and respiratory circulation. The timing matters. Drinking it within 30 minutes of waking helps counter overnight mucus thickening when the body is most congested. When used daily, this type of routine can improve mucus clearance comfort by an estimated 40–60% in many older adults, especially when combined with light movement afterward, such as walking or gentle stretching. It is not a cure, but it supports the body's natural clearance system in a way that standard medications do not always address. A minor side effect for some individuals may include mild stomach sensitivity if consumed too strong or on a fully empty stomach. People with acid reflux should be cautious with acidic additions like lemon and may prefer a milder warm ginger infusion instead. As always, individuals with chronic respiratory disease or on medication should consider discussing such. Before we finish, it's important to understand that progress with mucus and respiratory clarity is not just about what you add, it's also about what you stop doing. Many seniors unknowingly slow their own recovery by repeating a few key mistakes that keep the cycle of congestion active. The first major mistake is ignoring hydration timing. Drinking fluids irregularly throughout the day without a consistent morning routine allows mucus to stay thick during the most critical hours after waking. The second mistake is over-reliance on suppressive medications or constant cough control, which may reduce symptoms temporarily but does not improve airway clearance or cilia movement. The third mistake is low physical activity, especially shallow breathing habits that prevent full lung expansion and allow mucus to settle deeper in the airways. When you step back and look at this pattern, aging is not simply wear and tear. It is often a gradual loss of biological efficiency in hydration balance, inflammation control, and airway clearance. That means improvement is still possible when these systems are supported consistently. So here is a simple 30-day challenge. Focus on one structured morning hydration routine. Add gentle daily movement such as walking or light breathing exercises, and reduce habits that dry out or suppress your natural airway clearance. The goal is not perfection. It is restoring enough balance that your breathing feels lighter, clearer, and more stable over time, improving independence and day-to-day comfort. Changes with a healthcare provider.